All babies are at risk of catching infections when home from the hospital. The risk to premature infants is higher. These infections could be so severe that your preemie must go back to the hospital. Preventing infections in your preemie is important after discharge. One infection all babies are at risk for catching is called respiratory syncytial virus, or RSV. RSV is a common cold virus in children under 5 years old. Most children have had RSV by the time they are 2 years old. RSV is present during cold and flu season. The normal RSV season is November 1st through the end of March. This model represents an RSV infection in the bronchial tubes, or tiny airways in the lungs. Term babies have much larger bronchial tubes than preemies. As you can see, RSV creates mucus and swelling in the bronchial tubes. This mucus and swelling decreases the amount of air getting through. This infant is having trouble breathing and needs hospitalization. Some other infections that put your baby at risk are the flu, COVID-19, whooping cough or pertussis, gastric infections, and more. Here are some tips for preventing infections: hand washing, giving breast milk, social distancing, washing or disinfecting surfaces, not smoking, vaccinating, delaying daycare for as long as possible. When to call your baby's pediatrician: runny nose, cough, fever, vomiting, diarrhea, refusing to eat throughout the day, dry diapers throughout the day, excessive sleepiness, excessive irritability, and is difficult to console. One of the most powerful ways to protect your baby from infections is to vaccinate them and to vaccinate yourself. Protecting your baby from viruses like the flu or bacterial infections like whooping cough or pertussis is easy and necessary for those who share the home with your baby. Here are vaccinations for you and your family. Grandparents and other family members should also get these vaccinations. Flu shots are available during the cold and flu season, and whooping cough or pertussis vaccines called Tdap are available all year long in many local pharmacies, physicians' offices, and through the health department. Tdap is also available at Cleveland Clinic outpatient pharmacies. Getting yourself and others vaccinated prior to your infant's discharge could be life-saving, so please vaccinate. Your baby's pediatrician and other medical professionals agree that vaccinations are researched and recommended, safe, effective, life-saving, and necessary for the health of your baby and the community. Vaccinating your baby is an important line of defense against disease. Vaccines help strengthen your baby's immune system, and many protect your child throughout their lifetime. The NICU does not delay vaccinations for premature babies. These diseases could be life-threatening to your preemie, so it is advised that they be vaccinated on the same schedule as term infants from their birthday. One of the first vaccinations your baby will be able to get prior to discharge is the hepatitis B vaccine. You will be given a vaccination information sheet, or VIS, explaining the disease and the vaccine. Anytime the NICU gives a vaccine, we must obtain a verbal consent from you. Please refer to the NICU website at www.clevelandclinicchildrens.org/NICU for further information on vaccination safety and for printable handouts regarding vaccination records and schedules. The NICU will give you a vaccination record with your baby's vaccination date recorded. You may continue to have your baby's pediatrician fill it in as your baby gets vaccinated. Your pediatrician also has an electronic record of your baby's vaccinations through MyChart. A second electronic record for your baby's vaccinations can be accessed through the Ohio Impact SIIS program. The Ohio Impact SIIS program is a statewide immunization information system. This is an online tool that keeps track of immunizations and health information for Ohio residents, provides reminders for vaccination dates, provides immunization testing and screening information for schools, and keeps medical information available if you move. The medical team will automatically enroll your infant in Ohio Impact if they are vaccinated in the hospital. Your baby's pediatrician will continue to update MyChart and Ohio Impact. Please let the medical team know if you do not want your baby enrolled in Ohio Impact SIIS.